Cervical cancer is the leading cause of deaths amongst women, the leading cause of cancer deaths amongst women. And in terms of prevalence, is number 2, of course, following breast cancer in terms of cases. And cervical cancer is 100% preventable if we target cervical cancer from primary prevention to even up to tertiary prevention. Cervical cancer is very progresses much faster in women living with HIV because of their immune status. So the selection criteria is that we took healthcare workers working in comprehensive care centers within the county, so that then we empower them with skills so that they can screen those women of reproductive age who are living with HIV.
So basically my work, it entails supporting reproductive health services whereby cervical cancer screening is involved, HPV testing is involved, HPV vaccination is involved. From our donor, we have target, that is the number 1. So apart from the targets, we have women of reproductive age. So we want these women to be screened, and anybody who is positive, whether using the via recommended method by WHO or HPV DNA test, anybody who is positive is treated.
And basically in this training we are targeting the secondary prevention, whereby we are screening women who have lesions, and we treat those lesions using what we call either ablation or what we call incision. Now, in this training we focus on ablation, and among the ablation methods we have a newer method that's called thermocoagulation, whereby you're using heat to destroy abnormal cells on the cervix. The other, of course, ablation method is cryotherapy, where you are freezing those epithelial cells, those abnormal cells, to destroy them. The training has gone very well. We had 2 days of practical initially, and then 2 days of theory, and then we went to practicals in different facilities within the county, 4 facilities actually, and the participants were able to go through the procedure of screening using VIA, that's visual inspection using acetic acid. We managed to identify a few lesions which we treated, and the good thing is that the participants practice, so they are able now to visualize the cervix and understand the cervix and interpret the results.
One of the challenges that we have is, apart from the treatment that we do on site for those clients who are positive, we also have those ones with 75% lesion who needs to be treated at a higher level. So that is the gap that we have using the lip machine, which is not available in all setup. So there are those women who are being referred, and unfortunately, because it attracts payment, so they are not able to be treated. So by the time they come back to the clinic, the cervical cancer is actually in advanced stage, and that is why you see that we are also reporting mortalities related to cervical cancer.
I would say that CIHEB has really helped to empower healthcare workers, so that they can also do screening, so that we don't have any woman dying from cervical cancer.